Hi, I'm Dr. Bill Widener with Harbour Medical Centers, and today we're going to talk about what it looks and feels like to be a new patient with neck pain in our office. So when you first come into our office with neck pain, you will be seated in this beautiful lobby. You'll be presented some paperwork to fill out that's very efficient and easy to do with lots of help from our team. And then once you're done with the paperwork, you'll be guided by one of the case managers into our consultation room. So you'll simply come over here and you'll be welcomed into this room. And in this room, we'll be able to go over all of the details of your history, how you got to where you are now, what are the underlying causes that you think produced your neck pain. And then we can document those, get to know you really, really well, and then understand exactly why it is you want to get better. When we're done here, the case manager will then bring you to one of our providers, and one of our medical providers will start that examination. So we'll move from this room, we'll come down the hall, and then this is one of our exam rooms right here. And then in this exam setting, this is where one of our medical providers will be able to analyze you, do very important and special orthopedic and neurological testing, and then determine exactly what the cause of that neck pain is. From there, the medical provider will most likely recommend some advanced imaging. So we'll go down into our advanced imaging department. In here, you'll be led in here by our x-ray tech. In this room is where we have our digital x-ray machine. Either digital x-rays or very specialized diagnostic ultrasound are used to find out what's going on with the heart tissue, the bones of the spine, the vertebra, and or the soft tissue component with the ultrasound to see how the two are working together or are not working together. And then once we're done with imaging, and we can assess exactly what your diagnosis is, then if we can accept you as a patient, then we will talk about how we go about correcting the problem. In this room here, this is an area where with neck pain, if you have compressed discs, or if you have bulging discs, or if you have herniated discs, these machines here are our spinal decompression tables. These disc decompression tables help us to remove stress off the disc, which then takes pressure off of nerves, which then allows you to feel so much better. Then if it's necessary, and when it's necessary, to work on some of the inflammatory situations and components of your neck pain, this is our laser department. We have a number of different technologies here that help us to increase circulation, reduce inflammation, increase oxygen, and decrease the stress on the nerves in the neck and also on the soft tissue in the neck. Another room that allows our patients to get a lot of relief and corrective improvement is this passive therapy room. And in this passive therapy room, we have a whole nother family of technologies which helps us to reduce spasms, again, increasing circulation, decreasing toxins, increasing oxygen to those tissues. Now, as things are starting to improve, we want to package those improvements. In this room here, this is our active therapy suite. Here is where we can help to strengthen those areas around the neck to be able to hold those changes. And then finally, in this environment, this is where we do the postural changes. We have two different adjustment areas that help us to work with alignment, help with the curve in the neck, and help correct those postural distortions. So there's a quick overview of what you would be experiencing. Come check us out, and we would love to meet you and get to know exactly what is the underlying diagnosis with your neck pain.